Top cardiology secrets you must know. Welcome to MedEd 360, where we simplify complex medical topics for everyone. In today's video, we're going to unlock 10 essential cardiology secrets that you need to know to master heart health. Whether you're a healthcare professional or someone interested in learning more about heart disease, these insights will help you deepen your understanding of cardiovascular care. So, what are we waiting for? Let's get started. Cardiology secret number 1 is about the endocarditis prophylaxis. The American Heart Association recommends prophylactic antibiotics for certain patients undergoing dental procedures to prevent infective endocarditis, a serious infection of the heart's inner lining. The patients at highest risk are those with prosthetic cardiac valves, which are artificial valves used to replace the diseased native cardiac valves. Individuals with previous infective endocarditis are also at increased risk because they've already experienced this infection, and the bacteria can target the same vulnerable areas again. Similarly, congenital heart diseases such as tetralogy of Fallot or conditions that lead to abnormal blood flow in the heart also pose a higher risk. And finally, cardiac transplant recipients who develop cardiac valvulopathy, a condition where the valves in the transplanted heart become damaged, also require prophylaxis during dental work. It's important to identify these high-risk patients to prevent serious complications of the infective endocarditis like stroke or heart failure. Next secret on the list is the causes of the ST segment elevation on an ECG is a critical finding that requires immediate attention, but it's not always due to a heart attack. Let's discuss the differential diagnosis of ST segment elevation. The most common cause is acute myocardial infarction, MI, which occurs when a blood clot blocks a coronary artery, starving the heart muscle of oxygen. However, Prinzmetal's angina, also known as variant angina, can cause temporary ST elevation due to coronary artery spasm rather than a clot. Another somewhat uncommon cause is cocaine-induced myocardial infarction, as cocaine can cause severe vasoconstriction of the coronary arteries, leading to myocardial ischemia and infarction with resultant ST segment elevation. Pericarditis, the inflammation of the lining around the heart, is another condition that can elevate the ST segment. You might also see ST elevation in patients with a left ventricular aneurysm, left bundle branch block, LBBB, or left ventricular hypertrophy with repolarization abnormalities, benign early repolarization, and also conditions like severe hyperkalemia, where potassium levels are dangerously high, are additional causes to watch for. Next secret is about the maternal heart changes during pregnancy. Pregnancy is a time of significant cardiovascular changes. A woman's heart rate increases throughout pregnancy, primarily due to increased sympathetic tone and the body's need to support both the mother and fetus. Along with this, hormonal changes lead to increased plasma volume, which results from water and sodium retention. The increase in red blood cell volume, or erythrocytosis, occurs as well to ensure enough oxygen is transported to both the mother and the baby. As pregnancy progresses, stroke volume, the amount of blood the heart pumps with each beat, increases steadily. Overall, cardiac output increases by 30 to 50% during a normal pregnancy, making the heart work harder. During the first half of pregnancy, systolic blood pressure often drops slightly due to vasodilation, but it usually returns to normal by the time of delivery. These are some of the fascinating adaptive cardiovascular changes that occur during a pregnancy. Cardiology secret number 4 is about the major risk factors for coronary artery disease. These risk factors include hypertension or high blood pressure, also contribute significantly by increasing the workload on the heart and damaging the arterial walls. Another risk factor is diabetes mellitus. It increases the risk of CAD because high blood sugar levels damage the blood vessels and contribute to coronary artery disease. Another major contributor is hypercholesterolemia, or high cholesterol levels, which can cause plaques to form in the arteries, narrowing the blood vessels. Cigarette smoking accelerates the development of CAD by promoting the formation of plaques and reducing the oxygen-carrying capacity of the blood. Finally, family history, especially if a first-degree relative, like a parent or sibling, develops CAD early, before age 55 in men and 65 in women. Secret number 5 is a conceptual one. It is about the relationship of coronary flow reserve and coronary artery stenosis. Coronary flow reserve refers to the ability of coronary arteries to increase blood flow to the heart muscle in response to stress or medication that causes dilation. This reserve starts to decline when coronary artery stenosis, or narrowing of the arteries, reaches 50% of the artery's luminal diameter. However, basal coronary flow, or the regular flow of blood through the heart, does not decrease until the narrowing reaches about 80 to 90%. This means that significant damage to the heart can occur before symptoms like chest pain or shortness of breath even appear. Understanding coronary flow reserve is essential when assessing a patient for potential coronary artery disease. Now that was a little tough. I understand. If you're getting saturatory with all these top secrets, I would suggest you to pause the video, take a break, eat a snack, and also subscribe to the channel MedEd360 and like this video to show your support. Okay, so now let's resume. Secret 6 is very interesting. It's about the chest pain that is not always from heart disease. Not all chest pain is caused by atherosclerotic coronary artery disease. In fact, there are many other conditions that can cause chest pain. For example, lung diseases like pneumothorax, pneumonia, or pulmonary embolism, or cardiovascular causes like aortic dissection and pericarditis. Chest pain can also be due to esophageal spasms. It can be even due to skin disease like shingles on the chest, mimicking cardiac pain. Secret number 7, or sick sinus syndrome. Sinus node dysfunction, commonly known as sick sinus syndrome, refers to a group of conditions that affect the sinus node, the heart's natural pacemaker. These abnormalities can range from sinus bradycardia, where the heart rate is too slow, to paroxysmal sinus arrest, where the heart briefly stops beating. Patients with this syndrome may also experience sinus node exit block, where the electrical impulses don't travel from the sinus node to the heart muscle. A common manifestation of sick sinus syndrome is tachybrady syndrome, where the heart alternates between fast rhythms, like atrial fibrillation, and slow rhythms, such as bradycardia. Treatment often involves a pacemaker to regulate the heart's rhythm. Now let's discuss secret number 8, the causes of elevated cardiac troponin levels. Cardiac troponin is a protein released when the heart muscle is damaged. While elevated levels are most commonly associated with acute coronary syndrome or myocardial infarction, other conditions can also cause troponin levels to rise. For example, pulmonary embolism can cause elevated troponin due to strain on the right side of the heart. Aortic dissection can also result in elevated troponin due to damage to the heart muscle. Conditions like myopericarditis, inflammation of the heart and its lining, severe aortic stenosis, and chronic kidney disease can also result in elevated troponin, even in the absence of a heart attack. Let's talk about secret number 9, the causes of pericarditis. Pericarditis, or inflammation of the pericardium, the lining around the heart, has many causes. Infections are a common source, including viral infections like Coxsackie virus and bacterial infections like tuberculosis, especially in developing countries. Fungal infections, mycobacterial infections, and even HIV-associated pericarditis can lead to this condition. Neoplastic causes, such as metastatic cancer from the lung, breast, melanoma, or lymphoma, can also lead to pericarditis. Other causes include post-myocardial infarction pericarditis, Dressler's syndrome, injury from surgery, post-pericardiotomy, and radiation therapy. Metabolic causes, such as myxedema, hypothyroidism, and uremia, along with connective tissue diseases like lupus, can also trigger pericarditis. Let's wrap up the secrets with this last one, that is Prinzmetal's angina. Prinzmetal's angina, also known as variant angina, is a unique cause of chest pain triggered by coronary artery spasm, not a blockage. This spasm temporarily narrows the artery, reducing blood flow to the heart. Patients tend to be younger and often female, and their pain usually occurs at rest, not during physical exertion. The treatment primarily involves calcium channel blockers and nitrates, which help to relax the coronary arteries and prevent spasms. Recognizing and treating Prinzmetal's angina early. I hope these cardiology secrets have shed light on some of the most critical aspects of cardiovascular health. In such a short period of time, I have tried to cover 10 of the most common and high-yield topics in cardiology. Now it's your turn. What did you find most surprising? Have you seen any of these conditions in your practice? Leave a comment below and let's discuss. Share this video with your fellow healthcare professionals or anyone interested in heart health, and let's keep spreading knowledge together. And lastly, don't forget to hit that subscribe button for more heart health insights from MedEd 360. Stay tuned for the next video. Take care and stay healthy.